Hello, my name is Maureen, and I'm a care manager at the Greene County Council on Aging in Xenia, Ohio. Welcome to our memory loss, dementia, and Alzheimer's disease program. In this educational opportunity, I will talk about the various types of dementia, early warning signs, the importance of getting an early diagnosis, and what is involved in getting a diagnosis. As we age, it's not uncommon to notice changes in our memory. When we notice these changes, we may start to wonder why that's happening. So what are the causes of memory changes and forgetfulness? Well, there are many things that can cause changes in our memory and our thinking ability that are not necessarily related to dementia, but sometimes it can be dementia. The top of the list of things that we should check out and kind of be aware of is sleep. Do we have sleep issues? Can we sleep well at night? Do we have sleep apnea, insomnia? Do we have a snoring partner? Are we looking at our TVs and our phones too late at night and getting too much blue light that inhibits our ability to fall asleep? Are we drinking too much caffeine late in the day? Are we having too many liquids that keep us up to go to the bathroom at night? Or are we drinking alcohol, which can be disruptive to our sleep? Another thing to check would be stress levels. Do we have too many things on our mind? Do we have too many demands on our time? Are we worried about something? So that's something to pay attention to. Dehydration, especially in older adults, can cause some confusion and memory loss. And alcohol, are we drinking too much, too often? Is it disrupting our sleep? Are we killing brain cells by consuming too much alcohol? Do we have a vitamin B12 deficiency? And that can cause feelings of confusion. Are we in pain? Is that disturbing our sleep? Is that distracting us? Is that causing us to feel lethargic and absent-minded? Have we had a head injury? Something like traumatic brain injury or post-traumatic stress can alter one's memory and thinking. Illness and treatments. Medications can certainly interfere with our cognitive functioning and can really cause us to feel tired. So those are the important things to look at. And of course, it could be dementia. So as we go along with this program, we'll talk more about dementia and what some of the symptoms look like. So what can we do to help with memory loss if we're experiencing that? We haven't had a diagnosis of dementia yet, and we're just thinking about the list of things that I just went over. So some of the things that are high on the list to do is to try to get adequate sleep each night. Do all the sleep hygiene things that you need to do in order to get a good night's sleep. So you want to not drink alcohol 2 to 3 hours before you go to bed. You want to drink plenty of water throughout the day, but not too much before you go to bed. You want to have regular health checkups so that you'll know whether you've got some underlying health condition that you should be paying attention to. You want to exercise and move your body as much as possible during the day so that you feel tired at night. It's good to socialize and be with other people because that helps us to feel happier and satisfied and maybe a little less worried. And we want to limit the number of responsibilities that we take on. We want to reduce stress as much as we possibly can. And we want to keep our brain active and healthy. You may even want to look at our other video called Brain Fitness Know-How to see how you can do that. But what if our memory loss or poor cognition is related to dementia? Well, what is dementia? Dementia is not a normal part of aging. It is common, but it's not normal. Dementia causes difficulty in solving problems, controlling emotions. It interferes with a person's daily functioning and relationships, and impairs judgment and abstract thinking. Dementia is not a specific disease. It is a collection of symptoms that can be caused by a variety of disorders. Health conditions that can cause dementia-like symptoms include Alzheimer's disease, which accounts for 60 to 80% of all dementias. Vascular dementia is the second most common type of dementia. Lewy body dementia has additional symptoms such as sleep problems, hallucinations, and problems with behaviors. Hydrocephalus is when fluid is gathered around the brain and it puts too much pressure on the brain, and that can cause confusion. Parkinson's disease sometimes includes symptoms of dementia, but not always. Frontotemporal dementia is something that is often common in middle-aged adults and has symptoms that include emotional changes, loss of interest, withdrawal, not so much though with memory changes. Huntington's disease is an inherited condition that has symptoms that are similar to dementia. Alcohol-related dementia is something that we've touched on. Too much drinking over a long period of time can kill brain cells and lead to dementia-like symptoms. And thyroid issues can also cause problems with memory. Alzheimer's disease is the most common cause of dementia. Alzheimer's disease is a progressive brain disease that damages nerve cells within the brain. 60 to 80% of people with dementia have Alzheimer's disease. There are two types of Alzheimer's disease. One is called early onset Alzheimer's, which impacts people who are younger than 60 years old and who have inherited a very specific deterministic gene. Less than 1% of people with Alzheimer's have early onset Alzheimer's. Later stage Alzheimer's impacts those who are 60 years old and older, and this type may or may not be hereditary. Symptoms of Alzheimer's disease include increased confusion, loss of words, personality changes, loss of initiative, anxiety or agitation, fearfulness, loss of inhibition, withdrawal, hallucinations or delusions, impaired visual spatial capacity, difficulty following directions, and lack of awareness of safety issues. The main risk factor in getting Alzheimer's disease is aging. 32% of all people over 85 years old have Alzheimer's disease. And women are more likely to get Alzheimer's disease than men. Let's talk about those risk factors. After the age of 65, one's risk for Alzheimer's disease doubles every 5 years. 32% of people over the age of 85, as I said, have Alzheimer's disease. Women are more likely than men. It's 3 women to 1 male who gets Alzheimer's disease. And some people have inherited a gene for Alzheimer's disease that increases their risk of getting the disease. Cardiovascular health is important because the better our blood flows, the better our brains get oxygenation. Each time our heart beats, 25% of the blood being moved goes to our brain. So it's very important that we keep moving and keep that blood pumping in a healthy way. Traumatic brain injury increases the risk for developing Alzheimer's disease, and post-traumatic stress also is a type of trauma to the brain that can cause changes within the brain that increase one's risk for Alzheimer's disease. Alcohol consumption, as I've mentioned before, is another factor. And ethnicity. Did you know that Latinx populations have a greater risk of getting Alzheimer's disease? 1.5 times greater than their white counterpart. And African Americans, 2.5 times higher risk than their white counterparts. Persons with Down syndrome also have a higher risk of developing Alzheimer's disease. An education level may play a role in this discrepancy as well. It's thought that higher educated people or people who are very curious about things, who do a lot of self-learning, create new pathways in their brain and have more of them than a person who is less interested or engaged in life. And so they may have additional resources in their brain if a disease hits them. Here is a whole list of the differences between age-related changes and dementia. So this is something that you can look over and see if you're noticing any changes within yourself or a loved one. One of the things that's really important to remember when you're looking at this list is the person's level of functioning different from their baseline? So think about what you or what your loved one has always been like, and are they significantly different from that now? So an example would be if a person was always really good at balancing their checkbook and keeping really close detailed track of all of their money, and now they're not doing that, that could be a sign that they're not able to do it anymore. So that's worth looking into. Another possibility is if a person had a lot of interest, say, in woodworking or some other kind of craft and is no longer participating in that craft, there could be a reason behind that that is, problematic and possibly dementia related. And another example would be somebody who is usually quite social, but no longer wants to be around other people. So those are three concerning examples. So give that a thought, look over the list, and be thinking about these things as you experience changes in your own memory or noticing them in the person that you love. So it's important to see your doctor for a physical exam to rule out treatable conditions that can cause symptoms of dementia, such as depression, thyroid problems, drug interactions, vitamin B12 deficiencies, and hydrocephalus. Getting a diagnosis may include the following: a physical exam, laboratory tests, such as blood work, to rule out any treatable conditions that could be causing dementia-like symptoms, gathering a patient history, which includes noticeable changes, and this is where your family and friends can really be helpful. What are they noticing in your loved one that is different than the way it used to be? So that kind of information is important for the doctors to know, because a lot of times when we go to the doctor, we can present as being fine when we do have something similar to dementia going on. And so getting information from others is very helpful. A neurological evaluation would be done by possibly a geriatric neurologist, and they would probably perform some sort of cognitive or neuropsychological tests. And they may also require brain imaging through a CAT scan or an MRI. Getting memory and other cognitive problems diagnosed early is important. An early diagnosis allows one to be intentional with one's time and family and take beneficial medications, possibly enroll in clinical trials, and to take care of legal and financial matters. So talk with your doctor if you notice these symptoms, especially if they are different than one's normal baseline functioning. So you're going to look for confusion or changes in memory, depression, paranoia, agitation, difficulty with communication, such as finding words or inability to write, difficulty planning or solving problems and reasoning, impaired visual spatial capacity. So as we age, sometimes we would have cataracts or macular degeneration, but this is different. With dementia, you might be looking for trouble interpreting what one sees, difficulty following multi-step instructions or completing a task, misplacing things and blaming others for taking those things, confusion with time or place, withdrawal from social activities, or lack of awareness regarding safety, and even poor judgment, changes in mood and personality, changes in coordination and motor functioning, or even just new behaviors that seem inappropriate. Well, that concludes our program on memory loss, dementia, and Alzheimer's disease. Thank you for joining me today. I want you to know that all of us at the Greene County Council on Aging are here for you. So please don't hesitate to reach out to us by giving us a call. You can also check out our website where you'll find lots of good information about upcoming events and wellness programs. And you can also find more informative videos just like this one. So give us a call if you'd like to talk. Check us out on the web, and just know we're here for you when you need us.